when you're working with people that have suffered trauma, it's a very different experience to work one-on-one than in a class. So there are certain things that are the same, like there's certain things in the same, like how you might use invitational language, how you give people lots of options and don't require them to do things necessarily. And then there's a similarity in the physicality where you create a safe space where you as the teacher are not coming at them, standing over them, etc. But the difference, I think, and where sometimes people are confused is in private sessions, this is similar but different in that, like, we're in both cases trying to encourage people to have certain kinds of experiences. And the primary one is interoceptive or sensory experiences where you're feeling things in your body. You've heard probably a lot of times trauma lives in the body or in the tissues. And that's true in that in order to allow trauma to move and be resolved, right, the body has to be felt. If the body's cut off, not always, but it can be more difficult. So, often it's a good idea to whatever level a person can feel their body. And that could be as sort of big a body experience as like big asanas and as small as feeling the breath move in and out. But being in the body can be extremely useful. But when you're working with somebody who really is interested in like a curative, solution in terms of like working through their trauma, say, and hopefully they're supported by a psychotherapist of some sort, or social worker, or psychotherapist, or a psychiatrist, but some sort of mental health professional as well. But in private session, there's more of a place to allow them to explore how they feel about their trauma, or their reactions to it, or things that trigger them for themselves in a safe environment. So usually that's not going to happen with 20 people around you. But if you can create a container where that's possible, and you can resist the urge to sort of process with them, and use yoga practices to allow them to have experiences, and then maybe talk it out for themselves. So, in our retreats, we do a lot of like sort of active or listening techniques so that we can get used to, this experience of listening without judging, of not implying anything with our physical bodies or the things that we say. So in that way, it's different. And I think the other way it's different is that, you're working through the koshas, and in private sessions, you may have a better take on, where that trauma lives. I mean, it's quite likely in Vijnanamaya kosha, because that's where our unconscious patterning is stored, but it could certainly be in other places as well. And to really help people specifically with practices for that, so you're not just generalizing like a trauma-sensitive practice that doesn't trigger them. You're more looking in a private session at a practice that allows them to work with their bigger stuff in a way that is actually safe for them, or that they can do. And that's all about relationship. So, the questions around that were sort of like, well, what do I do? Do I simply just teach them yoga and not trigger them? Do I talk to them about their stuff? Do I, work with things? And so the answer is you slowly work into those koshic techniques that we learn in the course with their consent and permission. Once you've established a relationship with them that's solid, and once you have their consent, and, consent in this case can be tricky, I think, because sometimes it's hard to consent to what you don't know is going to happen, right? So consent is when someone can say, I understand that this technique might bring up this stuff, but to be honest with you, I'm really I'm really interested, in doing this work because I feel like that's going to be beneficial to me. And then so you give them techniques that might help them, let's say, deepen their access to their vision of mycosia, which could allow some stuff to move. And you would do that while explaining to them that you are a support system, but they also might need other supports.